Pudding Pals podcast, where the proof is in the pudding. What's going on, girls?
Oh, you know, just fought with my husband and the kids this morning. What about you guys?
Same as any other day, right, Ash?
I don't know, but Jordyn, I got to give you a shout out.
What did I do now?
Well, so obviously you guys know Jordyn, but I was in a panic because my kids woke up with pink eye. And I was like, it was like 6 a.m. I was like, I don't have time to like go to urgent care right away. So I obviously called Jordyn and I'm like, hey, so I know she's up at 6 a.m. I'm like, hey, do you by any chance have any pink eye medicine? She's like, hold on, let me check, I'll call you back. Next thing I know, 5 minutes later, I kid you not, I get a voice note that says, your order is ready for pickup at my front door.
You girls, just call me CVS, you know? Fast, friendly, and free, the best part. No copay.
Good.
No copay. I don't ask you for any personal information. Just pick it up in my window.
No questions asked.
And don't ask how I got it either.
partially used, but it worked and the kids are fine.
And she no longer has pink eye.
Nope.
So, Dr.
Good.
Jord to the rescue. Pharmacist Jord to the rescue. But in all serious today, guys, we're really getting into it. We have on an amazing pediatrician who's also, somewhat controversial. And this episode is kind of just really personal to me because of Mason. Mason's living with an autoimmune disease, and when he was diagnosed with celiac disease, we went straight to a Western medicine gastroenterologist who was wonderful, and he still is wonderful. But a year and a half into it, when he wasn't healing and he wasn't able to gain weight and grow, we searched for more answers. And we got connected to a more naturopathic doctor out of New York, and we had our first Zoom. And I'll never forget. The first question she asked us was, did your son have any negative reactions to any of the vaccines he had? And sure enough, the answer was yes. At 9 months, he had a febrile seizure from a vaccine that is suggested, all babies get. And that, that conversation has changed my way of thinking, obviously, because it makes you think, is this what turned on, she believed that is what turned on his genetic predispositions to his autoimmune diseases. Now, that's her belief, but obviously, like I said, it changed the way I thought about everything. And moving forward, I really do, my kids are vaccinated. They get the vaccines mandatory to go to school. However, we've chosen not to give any extra vaccines just because of that one meeting with her. But, the flip side of the coin to that is another year passed and we wanted to give it time, and he still wasn't healing and growing and gaining weight. So we turned to Western medicine again, and we turned to growth hormones, which is so controversial for a lot of people, And unfortunately, we had to stop the growth hormones because of a negative side effect, they believe, that was from that. But it just, it really gets, I know all of us thinking, how much information is out there, right, and how many different opinions there are. Eastern medicine, Western medicine, Google, influencers, moms, TikTok, ChatGPT.
Dr. Google's a big thing.
And, it really is really hard to sift through and know what's right. And I know even us sitting on this couch, some of us give the flu shot. Some of us don't.
Yeah, there's 9 puddings. 5 of us are here right now, and all of us have different opinions on our kids' health and the way we vaccinate and parent everything. And it's just, there's no judgment. And I believe that everyone has their own opinion. And it's also nice to hear the other side of it sometimes and see whether we agree or not, it's everyone's own opinion. And I think that's what makes us relate, which is exactly why we're so grateful to have Dr. Joel Warsh on today. He's a pediatrician here in Los Angeles. He specializes in parenting, wellness, integrative medicine. You may have seen him on Fox, CBS, and I think Staci, I know, has done a deep dive into this, and we're excited to have him on, so let's bring him in.
Let's do it.
Welcome to the Pudding Pals podcast.
Dr. Warsh, it's so great to have you here.
Thanks for having me.
Thanks for joining us. On the couch today is myself, Danielle. We have Ashley
Nice to meet you.
and Alexxa over there, Staci, Jordyn. So let's get into it. You've created such a unique space in the pediatric world. You know, you combined traditional medicine and holistic medicine, and I feel like that really speaks to our listeners and parents in this world because there's so much anxiety and they're so overwhelmed, and we're all just trying to do our best. So we're so excited to, you know, get into it with you. Yeah.
Thank you. Thank you for having me here.
I wanted to kind of start off, you know, I have a son who has celiac disease. And I wanted to kind of talk to you about the overwhelming amount of information out there, you know, from Eastern medicine doctors, Western medicine doctors, the TikToks, the Instagram stories. You know, how do we know, you know, what are the red flags when you're looking through all these opinions and health information, medical information?
Yeah, I think it's one of the most difficult things that we have to deal with today. You know, it's a very different world in terms of information. When when our grandparents were looking at things, they either asked their parents or they maybe went to the library and flipped open a book.
True.
and that was it, right?
What a concept.
And now you have your doctor saying something, you have influencers saying something else, you go online, you see the exact opposite information. It's impossible to know exactly who to trust. And it's difficult. I mean, I don't think there's an easy way to know exactly who the best person to trust is, but I think if you're looking for credible information, you can certainly start with the major bodies. You can look at CDC, American Academy of Pediatrics, at least say what they say, see what they say. And that's a good place to start. And then you start listening to other individuals, and hopefully over time you can get a good sense of how honest somebody is, how much research they do, how definitive they are about things. I think if somebody's giving you wonderful claims about things, you can be a little bit skeptical as opposed to having a balanced perspective and being like, well, I've seen this is what I think, this is what I've seen work. And I think over time you can get a sense if someone's being honest or not.
Okay.
But yeah, it's not always easy because it seems like the health world, the influencer world, the TikTok world is very much at odds with mainstream medicine right now.
Absolutely.
And the trust in modern medicine is gone.
Right.
And
I mean, yeah, I'm definitely my doctor is TikTok sometimes, and we have doctors in the family, so I send it. I'm like, oh my God, should I do this? They're like, Danielle, come on, like where is the journal, like the medicine journal that like backs this up? Like, are you serious? Like, that's not gonna work.
right, but everything can't have a journal article. I mean, I think it's good if you can use that, but at the same time, medicine and information changes so quickly. There's so much more information, and doctors are really bad at social media. It's not something you're trained in. A lot of doctors don't have those kind of personalities where they even want to do that. But not everything that influencers say is wrong. I mean, I think that medicine is super slow to change. They don't want to get involved in this conversation, and they need to, because things like celiac disease, we don't know why where they're occurring. But it's not unreasonable to start looking at root cause. It's not unreasonable to start listening to some of the influencer, other individuals who might have some solutions that seem reasonable. You can make wild claims, you can get way out there, but at the same time, thinking about food, diet, exercise, I'm like, that's not crazy.
Right.
But we don't talk about it in modern medicine, and that's what drew me to integrative medicine in the first place. It wasn't magical claims, magical pills that cure everything, but an understanding that people were going outside of the system and getting better. And you have to ask, well, why is that happening? Why are we saying you're going to have this condition for life? Then you go to a naturopathic doctor or some influencer or whoever, and your symptoms go away and you get better. Why are we not learning from that? We need to take that and say, okay, what are they doing? How do we bring that to modern medicine, and how do we find some sort of balance or blend those together? That's not crazy or woo. That's what we want to be doing. We want to be helping patients.
I have a question, because growing up, and I don't know if you guys can relate, I don't remember having friends with celiac or any sort of ailments or illnesses or even like peanut allergies. I really genuinely don't. But so why so many now?
I mean, that's the right question, right? The question is, why is it happening so much? I mean, the first thing we have to acknowledge is that chronic disease rates are skyrocketing. When we were growing up, I mean, if you go back like 50 years ago, it was like 5-10%. Now it's like 50% of kids. It's a staggering increase. Yeah, things like peanut allergies have tripled. Many things have quadrupled, tripled, 10 times over the last few decades, and we don't know why. Where are those studies? Where's the research? Where's the discussion? Even right now, most of the discussion even just centers around if it's even happening more. You know, or is it actually happening more? Or are we just better at diagnosis? Which is insane, because anybody who has kids, anybody who goes to the playground, anybody who looks around, any teachers who take care of kids, they didn't see these things 50 years ago. I mean, yes, there were some peanut allergies. There were certainly some, like there were some, right? But not like it is today. Like every other kid has eczema, allergies, autoimmune conditions,
Everything.
type 2 diabetes. It was literally called adult onset diabetes.
Right.
And now you're seeing it in kids.
Right.
So it's not insane to have these discussions. These things were not happening in kids. Lots of surgeons are saying they're seeing cancers they've never seen in kids before. Something's going on, and we need to acknowledge it. We need to talk about it. We need to be okay confronting it so that way we can make a change. If we just keep saying that it's just, we're better diagnosis, it's just genetics, we're not going to see any changes. We're going to see kids get sicker and sicker, and who wants that?
No one.
Do you feel like they don't do the studies because it's hard to get those randomized studies? Like it's hard. I mean, I know me as a mom, if my child had something, you know, and I was either going to get the placebo effect or I was going to get the real thing, like would I put my kid through that? Like do you feel like that's kind of why they don't study it, or do you?
Well, first of all, if you go back, it wasn't the issue. So it's a bigger issue now. We haven't even acknowledged that it's the issue until the last year or two.
Right.
I think you're hearing a lot more about chronic disease. You're hearing a lot more about these issues, and so now it's being brought to the forefront. It just wasn't really talked about 5 years ago. And doing a double-blind, correct study costs millions, maybe billions of dollars. It takes a long time to do it, and so it has to be a priority. And I don't think it was a priority before. Lots of people were talking about it. I mean, influencers were talking about it for maybe 5 years or so now, but not mainstream medicine. Mainstream medicine still hasn't acknowledged that it's even happening. And I think if all the doctors came out and said, look, this is a priority, this is happening, we must get these studies, we want the CDC to fund it, we want to do a big study over the next 10, 20 years going forward, it could happen. It would cost a lot of money, but where should we be putting our money if not that?
Well, speaking of modern medicine, vaccines definitely have a big play in modern medicine, but how do we know what is good to give our kids and what we shouldn't?
Yeah, I mean, it's the most controversial topic of all the controversial topics when it comes to kids. And I think we have to go back even before I answer that. For me, I did all the regular training. I trained at Children's Hospital Los Angeles. I very much was in the Western world. I met my wife during residency. She's very holistic minded, opened up my eyes a lot to the other side of things and the other, more natural world. As I've been in practice over the last decade or so, it's been really interesting to see how more and more parents seek out my practice just because they want to talk about vaccines. Right. The topic has been censored completely over the last decade. It's a little different now, which I think is why we can talk about it, and it's something that I wouldn't even talk about on shows, podcasts, anything, because you would just have your platform gone.
Right.
Yeah.
Right.
And you get in trouble. And that's not that's not right, but it just was the way that it was. And over COVID, I think more and more parents got frustrated. More and more individuals stopped trusting in modern medicine. We've seen hesitancy increase in vaccines. We've seen more and more kids not getting vaccinated. And to me, the entire topic just got so frustrating that I decided to write a book about vaccines, because I get these questions all the time, and I think there are a lot of things, a lot of items that we are so definitive when we talk about in modern medicine or what we're trained in, but it isn't actually true in what's in the research. And so that's why I wanted to write the book, to discuss this. And I think we have to have balanced discussions on vaccines. And it would be very arrogant of me to say I know better than the CDC, or I know something different. But I think there is a lot that we need to discuss. I think parents have more concerns than ever, and just shutting down that discussion doesn't really help. In the office, in the book, online, the only thing that I can recommend, any doctor can recommend, is the CDC schedule, because that's what's been studied, that's what's approved. Nothing else has really been studied. I'm not against people doing other things. I don't feel like people should be forced to do
Right.
anything.
But they do that with schools.
Right.
And that to me, it's like, how do you
yeah.
You can't go to school
navigate
without the
that?
vaccine.
Yeah,
if you-
but let me come back to that. So,
Yeah.
because that's a whole very important discussion. And I think, for me as a pediatrician, I just believe people shouldn't be forced. And I have patients in the office that do the regular schedule, some that do a slow schedule, some that don't do it. That's the way that everything else in medicine is. People can make the decision that's best for them. And that's what I think we need to do moving forward. And so that's what I recommend. I think if you want to do something outside of the schedule, you need to research it. You need to discuss and think about the risks versus the benefits, because everything has a risk. A vaccine has a risk, and the disease has a risk, and you have to decide what's right for you. And that is how we get there. But to the school stuff, I mean, that's frustrating to me. I don't think you should be forced to do it for school. There are lots of places that aren't. The reason they've done that is because it certainly works, right? It certainly works to get people to get vaccines because they kind of have to. Yeah. I mean, you don't physically have to do a vaccine. You cannot do it, but then you can't go to school here. So it effectively forces you to do it. And I don't know. I think that's to me, that's frustrating. I don't think it's right. Most people still get vaccines. Very few people get 0 vaccines. It's less than 1%. And there are many states and places that don't force you to do it. There are ways around it if you want to. And I don't think you should be forced to do vaccines to go to school. That's my personal opinion, but that's not the California's opinion.
The force with the COVID shot, I mean, you couldn't go any place. You had to carry a vaccine card, which was
Just to
being
go into
so
a restaurant,
forced.
we used to have to show our card
It's an
with
air
our
quote
stamp.
force, right? Because they say, well, we didn't force you, you don't have to, but you can't work and you can't do anything. So it's effectively forcing you to do it because that works. I mean, that's something that does work to make people to get it done, but we saw what's happened since. It doesn't work in the long run because it's not honest. It's not reasonable to force people to do things. They push back. And I think that was one of the biggest reasons why we've seen such a shift in the information to the point where we have people like Secretary Kennedy now, who's on the other extreme of all the vaccine discussion for years, because you're getting this pushback from being forced to do things. And I don't know, we're seeing the highest rates of hesitancy we've ever seen. And I think that's because people feel like they were forced to do things and were told things that weren't true, like safe and effective, safe and effective, safe and effective. And it's propaganda. It's not truth. You can't say something is safe when it's new. You can say something like, based on the research and data that we have so far, seems like the risks it seems like the benefits outweigh the risks. It seems like decreases your risk of death. It decreases your risk of going to the hospital. We don't know any long-term risks. Seems overall fairly safe in the short term. So we recommend you get it, but we just don't know these other things. That's honest, right? And there's nothing wrong with saying that. You don't know if you're going to grow a third arm in 10 years. Like, of course you don't know, right? Like, that's possible, right? But you have to decide based on that situation. And when you just say, oh, it's safe, they couldn't possibly know that at the time. So there's no reason to say it, but medicine has become so definitive. We're going to kick you out of our practice. We're going to not let you go to school. We're going to force you to get this thing. And I don't think a lot of people respect that. That's not how you partner with parents. At least to me, we're supposed to be convincing you. We're supposed to be providing you information. We're supposed to be saying, here's why you should get this vaccine. Here's what it does. Here's the risk from the disease. Here's how it reduces your risk. Here are the risks from that vaccine. Do you feel like that benefits you? Just like with a cancer medication, right? If somebody has cancer, of course we all know you have a risk of suppressing your immune system, your hair could fall out, all these things. You get to decide, do you want to take this medicine or not? There's going to be benefits, but there's going to be risks. And most people choose to do it, but not everybody does. Right. And that's our job. It's not to force you to do something. It's to give you the best information that we know at the time to help you make a decision.
Yeah.
So we hear the phrase, the dose makes the poison, right? Can you explain that? And if there is like a presence of substance in it, like in anything, does that make it like dangerous, right?
So dose makes the poison. Basically, the more of something that you have, the more likely it is to be dangerous. You could drink a ton of water, and eventually it could kill you. Yeah. So I think that's kind of the.
We talked about this.
The other day.
Yeah. So the general theory on most things is the more of a chemical that you have, the more dangerous it can be. A little bit of it is probably not going to be dangerous for you. That's not necessarily true for everybody, right? You could walk by a peanut if you have a peanut allergy and you could get anaphylaxis. It's not always the dose, but in general, the more lead you drink, the worse it's going to be for you. You drink a little bit, you're probably okay. It's not good for you, but if you drink a lot, you could die. Right. And so that is the, I guess, general discussion when it comes to vaccines. Oh, it's just a little bit of aluminum in there. Oh, it's just a little bit of the ingredients. It's not dangerous for you. And that's the mainstream opinion on most of these things, but not necessarily everybody agrees with that. And I
It's
think
kind of like McDonald's and vaccines, right? Like pick your poison, right? Like,
And does it depend on the person how a dose might
Affect them.
affect
Right.
them?
It's like he's saying the peanut.
Yeah, like,
course.
But let's say someone doesn't have a peanut allergy and they get a vaccine, and one kid reacts one way and one reacts another. Like, does that have anything to do with their like biological markup or anything?
Well, of course it does, but that's the right question, right? That's the question that hasn't been asked ever in mainstream medicine: is how are individuals different? Yeah. Like we have a schedule for everybody. We have a vaccine that's safe for everybody, and that can't possibly be true.
everybody's
And
so-
the right question to be asking, the right research that we need to be getting is, who gets a reaction and why?
Right.
And if we can figure that out, then we can reduce the reactions. We could save kids from having issues, and we can figure out what's going on and why. That's not anti-science or anti-medicine or anti-vaccine to say, hey, let's figure out, is it related to these things? Can we figure out what are the genetics? What are the supplements we could take? How can we detox better? Whose genetics? What is the reason why this kid's having a reaction? Let's decrease those reactions. What doctor wants to give a kid asthma or allergies or an autoimmune condition if you couldn't, right? But if you don't even admit that it could ever happen, you're never going to get to make them better. And what we want is we want kids protected from diseases, right? We don't want you to get measles or whatever, but we also don't want you to get a chronic condition. And we have to find that balance. And if vaccines are related to chronic conditions in some way, which we haven't really studied yet because vaccines are not studied long term, so we don't really know. Most vaccine research, the vast majority of it's pre-licensure, right? So before the vaccine hits the market, the companies do the research. They'll do it for a couple weeks, maybe a couple months. If you're lucky, maybe a year. You're not studying things for 3 years, 5 years, 10 years. And in general, there is some research after. We do have some ways to monitor some of these things, but in general, you're not really studying long-term anything. If you get asthma or you get cancer 10 years from now, are you going to say, well, it might be because of my vaccine 10 years ago? You're not going to think about that. You have no idea whether those two things are related. And we don't have any great ways to measure these things right now. And we certainly haven't studied vaccines together, right? You're studying them individually, but we haven't studied the cumulative schedule to have a really good idea of, are these things involved impacting some of these conditions? There is some research out there that says yes, some research that says no. Mainstream medicine says no, it's not related to asthma, allergies, autoimmune conditions, autism, all these things. But there's also a lot of concern that it might be. And the only way to actually figure that out is to do prospective trials, to follow kids that are vaccinated versus unvaccinated. We've never done it before. So to say categorically that it's not true, we actually don't know. We don't know that it does, but we don't know that it doesn't. And the right thing to do now would be to move forward
And check it
and
off the
to
list.
check
Get more
and
information
study
for
it.
parents.
Right, because if it
The
is,
information would make them feel more comfortable.
right, let's say you do that study. If it comes out that vaccines are related to asthma and you're increasing your risk by 10 times, wouldn't we want to know that? Wouldn't a doctor want to know that and say, okay, look, this is happening.
Right, in your
Why?
genetic family,
Why?
you already have like
what
a
are your
long
genetics?
history,
Maybe
so
there's an
that's not-
ingredient in
yeah.
there we could change.
Right.
We take it out, we get rid of that risk. And if it doesn't show that, that's the evidence that it's going to make parents more confident to do it.
You're not going to have them hesitant.
So we can't be afraid to do science. We have to actually do it and find what we find. And if it shows problems, so be it. If it doesn't, then it doesn't. But that's not anti-science to ask those questions. And that's what parents are asking.
Why do you feel like there's like such a hesitancy in trying that, like finding out the
I
why?
think they're worried they're going to find problems.
100%.
And you think it's just gonna like turn into a lawsuit? They're afraid
Yeah.
of like money
Think
at
about
the
it.
end
It'd
of
be
the
a class
day.
action lawsuit to everybody that has that in their kid.
All sorts of issues. I mean, it's not, first of all, this wasn't even discussed before. Second of all, it's super expensive and difficult to do, but it can be done. Certainly if you do like an open label trial, meaning it's really hard to get people to vaccinate or not vaccinate in a blinded trial where they don't know. You can't give someone a vaccine if they don't want it. You can't not give someone a vaccine if they do want it. But you could have people volunteer, and you could
They
still
did for the
follow them
COVID
forward.
shot, they
Yeah,
got-
exactly. So it's possible to be done. It's not the best study, but it's still going to be really good. But if you do that, you have to be open to find what you find and open up the discussion around potential problems. And once you do that, I think medicine is very worried that if you open up the discussion, it's going to cause all these issues for the entire platform, that you're going to have this huge controversy and they're not going to know what to do about it.
I feel like
which
we're
I
in
think
it.
is
It's
right.
real time. It's happening. Too late, party people.
It's happening. The train's left the station. It's
Yes,
happening now.
exactly.
So I
And now we
think
have this extreme.
right, and then you have someone like Secretary Kennedy who gets in there, who's talking about these things, and he gets the platform to talk. And medicine needs to be involved in that conversation and actually do the correct research to move forward. That's what I think needs to happen. It should not be controversial to get science. There's nothing wrong with it. If you believe that these things are perfectly safe, study it. Then if that's what's true, okay, great. I don't have any problem with that.
I think like, you know, everything in life, nothing is one size fits all. And so like why when it comes to vaccines, has everyone assumed it's one size fits all?
I would just say like medicine in general.
It's
like,
not. You're right.
just-
Medicine, medication. You know, I take all the pharmaceutical. I'm all
She's
for
our local
I'm all
pharmacist.
for pharmaceuticals. However, I know. Listen, Alexxa can't be taking what I'm taking. She'd be out for days. So
I don't even take cold medication. So yeah.
So it's just not a one size fits all thing when it comes to anything. And I think what you're really saying is like that vaccines need to be approached and.
I think all of medicine does. I mean, we have to reapproach medicine. It has a very old style. It hasn't changed, and the world has changed, but medicine has not. I mean, we've actually destroyed medicine. You have 3-minute visits with most doctors. There are not enough doctors for patients. There's not enough time to have discussions about health. There's no way to talk about food or diet or exercise. All these things that we know obviously are good for you, but you can't actually talk about them in medicine. You can't talk about vaccines. It's just you're kicked out of the office if you even ask questions or you don't want to do it in most places. And that is not the path forward. Doctors have to partner back with patients or they're going to become obsolete. And they have to get into this conversation using research and science, but not just mocking it or poo-pooing everything that influencers say just because it's on TikTok. Like, there's a lot of good information too. People figure things out. Sometimes they go on TikTok or Instagram or Google or whatever, and they figure out their diagnosis. Their doctor didn't even know what it was because they spent 2 minutes with them. Like that, it's a teamwork.
You have
we
to
need
be
more
your own
humility.
advocate too.
Yeah, you need humility. We do. Medicine is so arrogant, and it's just not. It's not the right path forward.
Yeah.
Okay, I have a question. Can you explain the difference between correlation and causation and like why it's such a big thing in the headlines?
Yeah. So if you do some sort of research, especially retrospective, 2 things can look like they're related, but it's really to do with a third thing. So that's why you have to do the appropriate, best kind of research. So you could say something like, in the summer we have more stomach aches, but also we have more ice cream. So if you have more ice cream, then you're having more stomach bugs. But really, it's just because it's the summer or some other thing, right? So that's where correlation and causation don't come in. So especially with things like vaccines, people could say, oh, we see, I don't know, more heart attacks around this certain vaccine. It could be because of the vaccine, but it could be something totally to do with something else or diet. Exactly. And so that's why you need to get the appropriate research to factor out the things that might be related. And that's where it comes in, especially with vaccines, because a lot of times people will say, oh, well, I had this vaccine, this thing happened, I'm blaming it on the vaccine. And it's not always to do with the vaccine. Some things just happen sometimes, and you get a heart attack this afternoon, you got a vaccine this morning, you might have had a heart attack either way.
Right.
So that's where,
to know?
Exactly. And so that's where a proper study where you factor these things in can actually look at the difference between correlation and causation.
Interesting. And then what about diet?
What about it?
So again, like I mentioned before, the McDonald's, but they won't give them antibiotics, but, parents give McDonald's, or, the way we eat, is that really affecting our own immune system?
I mean, I think, yes. I mean, for sure. We never were taught this when we were younger. Nobody thought about it, I think, before, because people just ate food. It was real food. You get it more locally, and over the years, everything's been mass produced. We've been taught faster, cheaper, easier. Right. Fast foods become normal, and we're seeing this huge spike in chronic disease. And at least we're just starting to get the research. I think it's pretty obvious that it is related, but how related, I don't think we fully comprehend that yet. But just logically, you're literally what you eat, right? So if you're eating a bunch of crap, and you're not eating nutrients, then how is your body going to function? We know if you have a bunch of sugar, your white blood cells don't work as well. Like, we can see these things through research, so we know that it massively affects you. And I'm sure if you're eating a bunch of chemicals and toxins all the time, and you're not getting the nutrients that you need, your immune system's not going to work well. You're going to increase your risk for every sort of chronic condition, and that's what's happening. And we have crappy food. It's not local. We're not eating real food. Even in the best case scenario, if you go to the better supermarkets, you're still getting things that are shipped in from other countries. It's still sprayed in all sorts of crap. Maybe it's organic, maybe it's not, but even if that matters, if it's sprayed in 10,000 other things. And that's the best case scenario. You can buy box things,
Oh
you
my
can buy
God, that
packaged
gives me
things,
so
you can
much
go to
anxiety.
McDonald's.
My hands are sweating. Like hearing you talk about the sprays, my hands are starting to sweat.
I mean, even McDonald's, right? When it was first McDonald's, it was probably real beef. It was real fries, real potatoes, salt. It was just a few ingredients. Now, look at the ingredients. You don't even know what any of that is. It's like 30 ingredients, and
Def not beef.
yeah, there's a small part of it might have been from a cow, right, at some point, but. So it's just not the same thing. We're not eating the same food. It's mass produced. It's about money, and we have to change that. I mean, we need to change it at the individual level. As parents, you have to do whatever you can to get the best possible food you can, meaning as local as you can, as fresh as you can. You can go to farmers markets and try to get to know your farmers and try to get some percentage of that from real food that was just picked. I mean, if you go, apple picking or berry picking, let's say you go berry picking. How long do those things last?
Yeah.
You pick it off the tree, it lasts like 2-3 days.
Yeah.
You think the berry at Whole Foods or whatever was picked 2-3 days ago? No, it was shipped from some other country. It was sprayed in a bunch of stuff. It's just there. It's 2-3 weeks maybe if
says
you're lucky.
organic.
It says organic, so maybe it wasn't sprayed in a pesticide or the pesticide that's not labeled organic, but it was still sprayed in other things.
Oh my God, I can't.
You're stressing her out now.
I'm sorry.
She's gonna now have a farm at her house just to make her own kale because she knows it can only be 2 days old.
But you can eat some of it, right? It's not that you can't eat any of it. I think the problem is it's just everything now. And I think that we're not conscious of it. And I certainly see, even in my practice, people are generally more healthier, not because of me, because they're just conscious of this stuff. Right. And I think if you're conscious of it, if you decrease your toxic load a little bit by looking at labels, looking at ingredients, trying to buy some stuff locally wherever you can. It doesn't have to be everything.
Staci has now bought like unbleached toilet paper.
Yeah, I don't even use.
Yeah, I just use it.
Thank you.
By the way, it's the roughest toilet paper. I hate using the restroom here.
There's some bamboo toilet paper. Yeah.
Use the bidet. Go use the bidet, okay?
Yeah, I have a bidet also.
So I have a question, just because we're on this topic right now, and obviously you can tell I have extreme health anxiety, but I've also made a lot of switches in my life over the last couple of years, is just we're hearing about so many younger, I know you touched on this a little bit earlier, younger people coming down with these chronic diseases and honestly, even cancer. And I am curious if what your thoughts are, and is it environmental? Is it food? Is it what is it? Is it what is it?
I mean, the first thing I would say is you shouldn't even consider it like anxiety. Like, it's just appropriate. Like, it's appropriate to have concern about what we're eating, what we're around. Like, the numbers don't lie. 1 out of 2 kids have a chronic condition, much more than that adults, like 75% now. Right? It's a big deal. So if you keep living the same way that everybody's living, you're going to have a chronic condition. You're going to be on multiple medications. We have a mental health crisis. We have all sorts of crises, and it's not unreasonable to be conscious of it. I think we do. We have to get the best possible food that we can, and just do the best that we can, and that's going to be good enough for most people. Yeah. And I think that if you feel like it's woo-woo, if you feel like you're the crazy parent, the one who's bringing your kid snacks to the things and you're the only one, then it can drive you crazy. You could feel like you're doing the wrong thing, like you're the bad parent, like you're the evil parent, but there are so many people that are this way now, and that's why there's this awakening and this anger in health, which most people are waking up to it. I think a lot of people are, and they're realizing that we have to see some big changes, but at least it starts with conversations like this, and we can start to move forward. We don't know why this is happening, but at least to me, it's the crappy food and too many toxins. I think it's the combination of those. Our body can handle
Toxins like household cleaners.
everything.
Okay.
So it's
Toilet paper.
Laundry detergent, it's all.
So your body can handle some, right? Our bodies are amazing. We have livers, we have kidneys, we can detoxify, we can get rid of a lot, but there is a point where it's just too much. And now we live in a world where there are chemicals and cleaners and toxins in our food. So there's just too many things, and the food is not good enough to nourish us. And so everybody's falling off a cliff, and that's why kids are getting sick earlier. That's why adults are getting sick earlier. That's why there are more conditions, I think.
Yeah.
And that's where I think if you are conscious of it and you decrease your chemical load a little bit, well, it wasn't like this 20 years ago. So if you live like that, then you're most likely not going to have those conditions. And that's probably going to be good enough and the best that we can do for now until we push things to change. And they are changing right now. I mean, I think there's a lot more awareness, a lot more discussion, and there's a lot more pushback. But yeah, I think, you know, if you can get a farm, great. You know, if you could get access to it, awesome.
Like,
you know,
purchase.
that's obviously not
Soil, like,
right. That's not practical for everyone. But I know a lot of people that have moved, right? They've moved out of cities and they're living, you know, not necessarily buying their own farm, but they're living in the middle of nowhere, Texas, or the middle of nowhere, Idaho, and that's what they've chosen to do.
Yeah.
And that's up to each person. But yeah, you can go to farmers markets, you can order farm boxes from places, you could read labels and you know, instead of using the chemically cleaner, use vinegar and water. Like there are a lot of things
Branch
that you can
Basics,
do. Branch Basics,
sponsor
whatever.
us.
Sure.
Staci needs some toilet paper.
Yes,
No, that's my cleaner. Yeah.
I have a question, like as far as your personal practice, when patients come into you, like a part of it is the food and how like nutrients and, you know, like you are what you eat. So if you don't want to have all these vaccines or like you need to eat your vitamins, like you're getting it from the food. Is that a way that you approach it? You just explain to everyone? Or like, because I know my 3 kids, like my pediatrician has never once said, hey, they kind of recommend like, you know, don't do a lot of processed foods, do a lot more vegetables, but it's not like the deeper connection is like, hey, you know, they're feeling a little sick. Have they had any vitamin C? Have they had
That's
whatever
never a
else?
thing at most.
It's never a thing. So that's
Western
what
Yeah, I mean, you have to learn a little bit about it, right? And I think that for me, it's being aware of some of these other things, some of the vitamins, some of the supplements, some of the relationship to food, not making fun of people for going to alternative practices like, you know, chiropractor or acupuncture, being able to offer those things also. Like sometimes you need a medication and that's great and it'll save your life, and I have no problem with an antibiotic if you need it, but medicine is so quick to give it because it's the only tool when there are many other things that you
I'm
could
so
do.
quick to take
I was
it.
gonna say, sorry, I'm so quick to ask for
Jordyn
it.
has it all.
But I think it's just important to be aware of it. And the more that we talk about it, the more that we're aware of it, especially because when you start to have these kind of conversations, the first thing that comes out from outside people is, oh, it's elitist. Oh, this is not what everybody could do. It takes so much money. And that attitude has to change. You can't not talk about these things because it might cost some money. Like that, you have to talk about it. Everybody deserves access to fresh food, healthy food. Everybody deserves access to the information. Sometimes it costs more, sometimes it doesn't. But it's not about being elite or being ableist or whatever words that get thrown at me and all sorts of people for talking about these things. No, it's about health. My job is supposed to be to talk about health. And if it costs more money, then that's what it costs, and we have to figure out how to do it. But also, if we don't talk about it, we're not going to see policy change and legal change, which is what we actually need. We need every individual to have that access to that kind of food. You don't not talk about it because it might cost more money. You say, how do we make it cost less money for everybody to get it? Like that's the way that we have actual change. But as soon as you start talking about it, you get that stuff thrown at you. And I'm sure, you know, watching this, that we will get that because we're talking about buying farms and joking, right? But it's like, well, but people are moving to these places, and actually these places cost a lot less than living in the city. You could buy a condo somewhere in LA for the same price as a studio condo. You can go buy a whole 10 acres in Idaho. It's not elitist. Like it's just
It's
about
true.
understanding what the difference is and what health actually is and used to be, and deciding what we value. And we valued for so many years quicker, faster, cheaper. And now I think the health part has to come back in the conversation if we want to see things change. You don't have to. You can live the same way everybody else is living. But 1 or 2 kids have a chronic disease. Do you want that to continue? I don't. So I'd rather see some changes. And not everyone's going to move to the middle of nowhere in the mountains, but at least you can start to find some middle ground.
I just think the extras that are not part of like a typical medical practice is what's cost the extra, and people say like, you know, well, it costs too much to do that, right? Acupuncture, chiropractor, that's not covered by insurance, or, you know, or, you know, the red light therapies, or.
But we have to make it covered.
Of course,
We have to
of
make,
course.
there's a lot of discussion
that
right
Yes,
now.
exactly.
A lot of discussion right now around the fact that people are pushing doctors around a lot of this stuff. That's what's going to make it change. Doctors have to be forced to learn about it from patients because they want to know about it, and then we have to force insurance to cover it or fund, you know, HSAs or whatever. Find a way to make it accessible to more people.
everyone,
That is the future if we want people to be healthy. It's not saying, well, it's elitist to talk about it because most people can't afford it. No, how do we make it possible for people to get access to it?
Exactly.
Question for you, Dr. Joel. This is a little different subject, but screen time. Guilty over here.
Yeah.
But
It's a major topic on this show, screen time, always.
we all definitely have used the iPad for a babysitter or the TV. Growing up, we watched TV. So how much really is dangerous? Because my mom never said, turn the TV off. Like, this is dangerous.
Yeah, I think there's a lot of concerns around screen time. I mean, the official recommendations for little kids is no screen time until 2, but that's not reasonable. Every kid has some screen time these days.
Or the second child. I mean, my first
Yeah.
child never had TV till he was 2. The second one,
Exactly.
2 days old, he was in front of the
but,
TV.
you know, even
My
sometimes
18-month doesn't run iPad.
yeah. Most
So what is realistic?
most parents or many parents come to the office, they're worried because their second kid's watching something because their older one's watching it, and they're worried it's turning their brain too much. That's not true. We all watch TV, right? Screen time's not inherently bad for you. It's what you're not doing. The issue we have with screens right now is older kids. They're watching screens 7 to 9 hours a day on average. It's way too much. They're not getting outside. They're not playing. They're not active in the community. They're not doing things. That's what to me is concerning, not 5 minutes of watching a screen. You can learn from a screen. I mean, there's lots of studies back from 20 years ago on Sesame Street and things like that where
Right, we learned all that.
you actually learn very well from screens. It's just you don't learn as well as when you're actively learning from a parent, but you still learn things. So do you want a screaming toddler for 6 hours? Or no, do you want a screaming toddler for 20 minutes? Or if you're in a car ride and you want to give them a screen for 30 minutes, is that really the problem? No, I think it's the 9 hours that's the issue. So I don't think parents need to be so hard on themselves. We all watch some screens. It's not going anywhere. I think you minimize it as much as you
moderation of it,
can.
maybe.
Yeah,
Yeah.
minimize as much as you can and don't use it instead of parenting, right? You don't want to plop your kid in front of the screen for 3 hours. That's a problem. But if you need to go cook something, go to the bathroom, do something for 10 minutes, that's not the issue. Especially if it's educational content.
That's awesome. Thank you.
Right. Well, Dr. Warsh, we can't thank you enough for being here. This was such an amazing topic.
So informational, so great.
So great. Yeah.
Stacy wants your phone
I
number.
like want
on
to talk
speed dial.
when we're done.
Stacy's making an appointment.
I
For
think
herself.
you being so open-minded of just getting the information to parents, you know, on both sides is just so refreshing to hear. You just came out with a book. Congratulations. Between a Shot and a Hard Place. And you just brought us some, so I can't wait to get into
Yeah,
that.
we're all gonna get into it. Can you tell everyone where they can find your book and find you?
Sure. The best places are probably Instagram or X at Dr. Joel Gator, or the book Between a Shot and a Hard Place. You know, all the places you can get books.
Awesome.
Well,
Thank you.
congratulations.
Thank you
Thank
for
you for
coming.
coming.
Congratulations. It's
Thanks, guys.
amazing.
Thank you.
Thanks
Amazing.
so much.
Welcome to the Pudding Pals podcast.
All right, girls, that was incredible
So great.
So informative.
and so interesting. And I know there's something for everyone to take away.
sure.
And I just love that.
So do I. But you guys want to play a game?
Let's do it.
Let's do it. Let's do it. Kids Healthy Edition.
All right, here we go. I'm going to lose.
Fingers up.
I'm gonna lose. You cooked yesterday.
No, I
You're
mean
gonna
not lose. Like, I'm not going to get any fingers in.
Okay. Never have I ever Googled my kids' symptoms and convinced myself they had something.
So I don't believe in Dr. Google.
Oh, you don't, Alexa? Wow.
Yeah. Lucky
I
you.
Dr. Google everything.
Never have I ever accidentally given the wrong dose of medicine and then panicked silently.
And called poison control.
yeah.
Oh,
Wait, I
oh,
saw
that's serious. A few weeks ago that Camden ate an Ativan. I was like,
Nowhere near.
nowhere near it. But I was
I freaked out. That would have been bad, yeah.
She'd have a real long nap. Never have I ever sent my kid to school with a fever just to see what happens.
What if you give them Motrin before you sent them?
That's still a fever, Jordan. That's just band-aided fever.
Never have I ever had a mini panic attack over a rash or weird bump. Never have I ever tried to convince my kids that medicine tastes like candy.
Always. Jordan lost.
Jordan lost. All right, Jordan. Dare to dip or spill the pudding?
I'm just gonna spill the pudding. I'm never gonna dare to dip.
Come on.
Okay, I'll dare to dip.
All right.
Very blunt, so it's easier to tell the truth.
Dare to dip. Read your last 5 Google searches aloud. No skipping.
Okay. It's all gonna be pepper.
Oh, here, let's just look at all of this. Hold on. People,
CNN.
You're boring. Dry Bar.
Faithful the brand.
Baseballism.
Just sounds like you've been spending a lot of money this week, Jordyn.
You know, at any given time on my phone, I will tell you this. A lot of times I'm Googling, I'll find like a pill on the floor or a pill in the cabinet. And I'm like,
Yeah. What is oval G126? Yeah, I've done that before.
So if we could get to it, that's probably would be like, I organized my room this weekend. I did a lot of G126 red pill.
You didn't just throw it away, Jordyn? Oh my God.
Not if it's a good stuff. That shit goes right back in my cabinet.
All right, girls. Well, another fun episode. This was great. And let's cheers, girls.
If you think this information will resonate with your friends or your family, share this episode with them, like and subscribe, and we'll see you guys next week.
Yes. Bye. Cheers.
Cheers.
Cheers.